All right, we are officially started. Need a timekeeping device. There we go. So first, welcome everyone to this wonderful webinar on autoimmunity, a gut-based approach. For those of you who don't know, this is in follow-up to a previous webinar we did, autoimmunity, a food-based approach, which is recorded, and you'll be able to have access to that as well. And this is being run by the GW Office of Integrative Medicine and Health. I am the executive director of the office, and Janet Rodriguez is the administrative director. So thank you, Janet, for getting us all organized and making this happen. It would not happen without Janet. Excellent. And a little bit of background on myself before I turn it over to my co-hosts. I have a PhD in nutrition and a master's in immunology, and I really like to put those two things together. And that's where I ended up talking about the gut microbiome, because it's kind of really a natural fit. So this is definitely something that I'm passionate about, and I think it's something we could talk about for just, hours and hours. But we're trying to keep this short and condensed as a really good intro, and then keep that lens within autoimmunity. So I will turn it over to Susan, Dr. LaLacheur, to introduce herself.
Thank you. I'm Susan LaLacheur. My doctorate is in public health, and I am a physician assistant and a professor at GW in that department. And I do teach some of the gastroenterology and many other things in the curriculum. But I've long had an interest in integrative health and have been utilizing it for my own and the health of my patients for many decades. Lara?
Thank you. So I'm Lara Zachariah. My background's originally in pharmacy. So my undergraduate and my doctorate are in pharmacy. And I have a master's in nutrition. And a lot of my focus in the nutrition space has been around the biochemistry. I'm also this close to finishing my public health degree. I'm very excited to see that wrap up. And that to me is how I layer in the nutrition communication, knowing how to and when to talk about strategies and ways for us to hopefully prevent disease, but also how do we reduce risk when it comes to that overlap between nutrition, the medicine and the medical model, and how do we get our population to improve their health. I really love the topic of autoimmune disease. I actually really love the whole aspect of where autoimmune disease, inflammation, immune system overlaps with all the other various factors. It's not in a bubble, and how they all interact with each other. And so that's what I end up talking about a lot. And I'm excited to say that I'm also in part of the GW family as adjunct assistant professor. And a lot of what I'll be talking about and teaching about is biochemistry and immunology related. And so this is, I think, a great platform for us to start that conversation. So thank you.
I would also add that you're getting your MPH at GW as well. So you really
are
GW.
I am really GW through at this point.
Excellent. Well, thank you. So with that, I think we'll go ahead and get started. And I believe that, Larry, you are starting us off with just some background on this concept.
Yeah, absolutely. So one of the things I always like to clarify is that autoimmune disease is not necessarily about the target. It's about the imbalance in the immune response and how it ends up taking that target down with it. So we've often thought about like autoimmune diseases like Hashimoto's or rheumatoid arthritis, and we think about specifically them being diseases of the thyroid or diseases of the joint. IBD, which is inflammatory bowel disease, which is a disease of the gut. These are all autoimmune diseases, but they're often classified by the place where the damage occurs. On the flip side, though, the issue isn't the gut or the joint or the thyroid. The issue is actually, why did the immune system decide to target that particular tissue? And to me, that shift in framework really is what creates space for us to start thinking about integrative strategies to mitigate autoimmune disease, both to reduce its you even developing an autoimmune disease, as well as to reduce and put it into remission if you do develop an autoimmune disease. Another factor I think that really like highlights the shift in strategy and the need for the strategy, we know that once you develop one autoimmune disease, you're more likely to develop a second and even a third. We also know that women are disproportionately impacted by autoimmune diseases, that there is a hormonal, genetic, sex variation that impacts risk for women in particular. So when we start to think about it more holistically and we start to think about why the immune system goes out of whack, why it chooses the certain target that it does, it becomes that much more, I think, important to think of the imbalance on the immune side versus on the target side. Because if you have celiac, you have Hashimoto's, which are two really prominent autoimmune diseases, it's not enough for us to just dim the immune response. We have to understand why it's continuing to drive that destruction to the tissue, because before you know it, another autoimmune disease might develop, and we definitely want to reduce the risk of that happening. So conventionally, we'll use immune suppressors. There's different classes. They hit different parts of the immune system depending on the type of autoimmune disease. There's some that are more favorable in some versus others. In some cases, we actually just leave it alone even and just hope that it doesn't get worse. And I don't think that's enough of a strategy. I think it could be helpful for reducing symptoms for people. I think it'd be helpful for reducing tissue damage. And I think that's really important to hold space for that. But I would love to see us continue this conversation from an integrative space of how could we actually rebalance the immune system so that it more upstream reduces the tissue damage, that from an upstream approach, we're reducing some of the triggers that create that imbalance to begin with. That's going to have just a better overall outcome for us.
That's great. Thank you. And just encourage everyone, if you come with questions, please feel free and put them in the chat now. We will have a Q&A session at the end. So next up, how do we improve our gut? And when we talk about improving gut health, we really have to talk about the microbiome. And when we talk about the microbiome, we have to talk about feeding it. You got to make sure it's getting what it needs. And what does the microbiome eat? Well, it eats fiber. You may have heard of the term prebiotic, and that's just a subset of fiber that we know that the microbiota like to eat. So it's good fiber, though really all fiber is good fiber. It's just a very specific kind. And they eat this, and it's important for their health, and thus it's important for our health. And one way that we know that is prebiotic fibers support gut microbiome diversity. And diversity in the microbiome is really the only consensus marker we have now on what a quote unquote healthy microbiome might look like. Not that it's definitive by anything, but that's really what we use kind of as our marker now of a healthy microbiome. Now, how do you get prebiotic fiber? You get it in vegetables, fruits, whole grains, and legumes. So plants, that's where the fibers come from. So you have to have some plants in your diet to be able to feed your microbiome. What else should we know about in terms of feeding them? Well, fermented foods also can play a role here. And it's traditionally fermented foods. So not the short fermentation that you're like sort of mock making with vinegar. That's not the same thing. So they actually have to be fermented, and the fermentation process comes from microbiota. So if you're eating a food that has been fermented, as long as it hasn't been pasteurized, it has live probiotics in it. Now, even if it's been pasteurized, there's still some thought that perhaps that's also beneficial because of what they have done to the food. They've left behind their markers. They're what we call postbiotics now. So basically, fermented foods are good, really, in kind of any form you can get them. And what do we talk about? We're talking about sauerkraut, kombucha, kefir, yogurt, pickled veggies. Those are really what we think about in terms of fermented foods. All of them are good for you and for your microbiome. What else does your microbiome want? So it wants sulfur-rich detoxifying foods. So these foods, they actually help with detoxification capacity. And you hear terms like, oh, I'm going on a detox or I'm going on a cleanse. That's not what we're talking about here. We're talking about your body doing it itself. And it's doing it itself all the time, but it needs the right building blocks to do that. And these sulfur-rich detoxifying foods provide those building blocks. And that allows your body to reduce oxidative stress and decrease cellular damage. So it's doing it all on its own. But how do you find these foods? Well, they come in two categories, the alliums and the cruciferous vegetables. The alliums are things like onions, garlic, leeks, anything that's got that kind of oniony, garlicky smell or flavor to it, that's an allium. And then cruciferous vegetables, these also have kind of a unique smell to them. It's the sulfur. Brussels sprouts, broccoli, cabbage, kale. So everything that's the kind of cabbage smell to it, that's a cruciferous vegetable. And so you need to make sure you're getting enough of those in your diet to allow your body to detoxify itself. Anti-inflammatory foods. So we know that anti-inflammatory foods are good for us, right? We've heard that. What they're also really important for your gut health and for your microbiome. Now, many foods, herbs, and spices have these bioactive compounds that help reduce inflammation and oxidative stress. That's the good news. They're in lots of things. Some of them have even been linked to improving the microbiome. That's even better. What are these plants? And what I want you to key on is it's a rainbow of plants. That's really the key here, is getting a large variety of different colors, especially in herbs and spices. Things like avocados, curcumin, green tea, and olive oil are really chief among those. And as well as seafood and ghee also have anti-inflammatory processes. And we will have a really wonderful handout for you at the end of this talk that goes through a lot of the points that I'm covering right now, and will help you figure out how you can fit these different foods into your lifestyle. And we also have one that has a beautiful rainbow on it that will help you identify the different colors to make sure you're getting this rainbow of plants, because you will see this is going to be repeated over and over again right here on this next slide. So the other reason that we need a rainbow of plants is phytonutrients and polyphenols. And that might be a little complicated. Basically, these are naturally occurring chemical compounds in plants. For many of the plants, it's what gives them their color, or it's actually a natural pesticide. They're important really for the plant, not so much for us, but we developed benefits from them. And those benefits are really protection. They're anti-inflammatory, but they also support a diverse microbiome. And one of the ways I think to really understand the importance of phytonutrients for the microbiome is to understand how they're digested in our body. So when you eat something that is, maybe heart healthy, right? It's got all these phytonutrients, you're eating because it's heart healthy, and you're digesting things and you're getting some nutrition out of it. Only about 10% of the phytonutrients do you digest. So 90% of them are making it to the microbiome, and the microbiome is the one that is digesting it and making it bioavailable for us. So without the microbiome, we really wouldn't get a lot of these health benefits. But I think it also really drives home that these are not just for you, right? These are for them too. They're processing these, and it's really important for them. So we need to make sure we're getting that rainbow of plants for us as well as for them. And in terms of phytonutrients, dark green leafy vegetables are fantastic. All the different colored veggies are great. Berries are really rich source. Also cacao, so we're talking dark chocolate, the darker the better. Coffee, especially if it doesn't have sweetener in it, because then we're really just getting that polyphenol boost. And then any sort of tea, so that's herbal tea or green tea, black tea. All of those teas are really high in phytonutrients. Well, this one you probably realize, right? We need minerals and vitamins in our life. It's in part and part of our body, and it's also important for our microbiome, but it's really important for our immune balance. So Lara gave us a little introduction to the fact that the immune system is important in all of this. And it's not just for the microbiome, it's important for not just for the autoimmunity, it's also important for the microbiome, because we want to have an immune reaction to those that will make us sick, the ones that are called pathogens, but we don't want to have an immune reaction to the ones that are supposed to be there, the ones we call commensals, the friendly, the good bugs inside us. So having that right immune balance is really important. And in order to do that, we need to make sure we're getting enough vitamins and minerals. And the chief ones among those, and when we're talking about immunity, are vitamin A or beta carotene, vitamin C, vitamin D, which everyone knows I love, vitamin E, zinc, and selenium. And just a couple of quick tips on this. A lot of these you're going to get from that rainbow of plants again. So that's exciting, right? Vitamin A and beta carotene are often in your orange vegetables or your green leafies. Vitamin C from citrus or red bell peppers. Vitamin D, that one's a little bit trickier. So we've got that down here. You can get it in fish. You can get it through sun exposure. And unfortunately, most people don't get enough sun exposure because we work inside. So you might need to supplement for that one. In contrast, vitamin E, I would say try not to get that from a supplement because it doesn't seem to be as beneficial. You want to get that from your nuts. That's the best way to get your vitamin E. And the same thing with zinc and selenium. You should be getting that from your food sources. Broadly, nuts are a great source. Selenium, Brazil nuts. You only need 2 Brazil nuts to get your whole day allowance of selenium. And then getting that rainbow of plants should also help with those minerals. And then, of course, beans and legumes are also great for you and great sources for these. And making sure you're getting a diversity of diet will make sure you're not missing out on any one of these nutrients at one time. So now I'm going to turn it back over to Lara, who's going to give us a little bit about the mechanism on this.
Thank you so much. What a great introduction to that food aspect of and the nutritional aspect of not only gut health, immune modulation, but gut health in general, which has its own kind of synergistic effect, right? So when we're talking about the reason why these interventions are useful, we've got a compounded mechanism at play here. One is just the straight metabolism of the fiber. It produces something called short chain fatty acid, SCFA. You might see that abbreviation. And these have been shown to not only improve the environment of the gut, but to potentially also improve the endothelial barrier, essentially the lining of the gut itself, reducing the risk of having intestinal hyperpermeability and reducing the risk of some of the compounds that are in our gut escaping out of the gut and going rogue and getting into circulation and potentially creating damage all across the body. That's one of the primary drivers of a lot of disease. So when we think about the gut connection in metabolic syndrome, in Alzheimer's and dementia, and in autoimmune disease, one of the primary drivers is what happens in the gut stays in the gut or doesn't stay in the gut. When it escapes the gut and it ends up creating damage elsewhere, it starts to create damage at a cellular and tissue level. And that's why the two are connected. So when we think about why is it that what happens in the gut is so foundational to various disease states, it has a lot to do with that. The production of these short chain fatty acids helps on multiple levels to prevent and mitigate that from happening. It also helps to reduce the risk of having dysbiosis. It feeds the good guys that are supposed to be in the gut and makes sure that they're fertilized and that they got all the nutrients that they need in order for them to thrive. And that reduces the chance of the good guys getting starved out. And when they're starved out, that increases the risk of having things that are going to populate where they're not supposed to. And that is what sets the stage for something called dysbiosis. Dysbiosis can increase risk of inflammation, at least at the gut level, at minimum, as well as increasing the risk of intestinal permeability and or also called leaky gut. Now, that's really important because our barrier function is one of the primary baseline prevention factors when it comes to making sure that our immune system is robust and healthy. I think about it like a gate around a castle. And I think of our epithelial lining, that lining of the gut, as being that first primary gate. No one's going to come through that gate unless we let them. Now, if there's a crack in the fence, some guys letting some guys in that aren't supposed to be in there, that is going to allow then for potential pathogens to come in, which then could trigger the immune system, which then could create sort of a chronic inflammatory response that could be one of the triggers that creates an immune disease, or at least immune imbalance. In addition to that, I mentioned, the benefit in terms of making sure that our microbiome has good, robust, commensal good guys, right? These good guys are like the army that surrounds this castle. It's the guards, the protectors, the little guy standing at the top of the tower, keeping watch, making sure nobody comes in. It's the guard at the gate, making sure that nobody gets past him, right? Or her. And making sure that those guys are robust helps to reduce the risk of potential foreign invaders from coming in and occupying our castle, right? As a result of that, this balance, not only the prevention of having the bad guys come in, but also making sure that we have healthy amounts of the good guys in and of itself helps to balance the immune response. And that's because a big chunk of our immune system, up to 80%, is actually initiated production in the gut, in that same lining. So you can imagine if you've got a good, healthy gate around you and your guards are keeping the bad guys out, that's going to improve the chances that that immune system, that the parts of the immune system that need to be regulated and produced there are easily and readily produced, and that they're not overreacting to potential invaders and triggers that aren't supposed to be there. So as a result, this piece of the microbiome, this gut connection with the inflammation and inflammatory imbalance that's associated with autoimmune disease, is extremely foundational when it comes to autoimmune prevention and mitigation. I would argue it's probably invaluable in pretty much every disease state I can think of. I don't know if you guys can think of a disease state that's not impacted by gut health. Let me know, chat me if you can think of something. But it's exceptionally important when it comes to immune health, because remember what we said, the immune balance is the piece that dictates the disease progression and the potential progression of multiple autoimmune diseases. So if we can make sure that, one, we've got all the resources that we need to produce the right kind of immune markers, the right kind of protectors on a gut level, if we, two, prevent the leakage of things outside of the GI tract, so it doesn't end up going and wreaking havoc in different parts of the body where it's not supposed to be, and that we ensure that our guards, our sentinels, are there to also help support the balance of the microbiome and to make sure that no foreign invaders potentially trigger or create excess inflammation on a gut and then systemic level, then we'll be in a pretty good place to either prevent the progression of an autoimmune disease or to potentially put that autoimmune disease into remission.
Wonderful. Thank you so much. I could listen to that for much, much longer. We could go into much more depth, but I think that's a great way to give you the information you need. And then to talk specifically about some certain autoimmune conditions, we have Susan LeLacheur. I will turn it over to you, Susan.
Thank you. I just want to add one thing to what Lara was saying, and both of you know this. The other piece about the gut. So I love your imagery, but my image is that the gut is a tube of the outside world that lives inside you. You know that it's everything that happens in there should not be interacting except as your body wishes to have it pulled in to the system. And 60% of your immune system is inside your gut in these little things called Peyer's patches. So it's not just in the interaction between the microbiome and the Peyer's patches, not real clear, but there's a lot going on there, right? So certainly one influences the other and vice versa. I'm not going to go deeply into these studies because I know most of you are not medical people, but I want you to know there's a ton of research on various autoimmune and immune-related diseases right now, and the microbiome. Microbiome research has just gone haywire in the last 5 to 10 years. It's amazing. And some of these are, you can see this first one I list is a huge study, population level study. A cohort means they just grab a bunch of people and watch them for a period of time, right? That's what that means. And what they do, and they're taking certain assessments along the way. The most studied diet is the Mediterranean diet. And it's just because it's quantifiable, we can say, mostly these foods and not those foods. There are certainly other diets, and that makes a lot of the research difficult because it's like this diet didn't work, but this one sort of worked, and that, there's a lot of that going on. But these people, what they looked at is there's a score that says how close to the Mediterranean diet did you get? And people with higher scores had almost a 60% reduction of Crohn's risk, which is that prevention piece, that we're actually able to prevent disease using diet. Multiple sclerosis, there are a ton of different studies with a ton of different diets and supplements. And because each diet is different, we get highly variable results. There is currently a prospective randomized trial going on at the NIH. So if you have MS or know someone with MS, consider looking into that. And you're willing to do what they tell you to do in terms of diet, which I'm not, thank you very much. I have MS, by the way, and have been using diet to manage it for decades. I am 66 years old right now, and my first symptom was age 19, and I still work full time and walk and talk and do all those things. So, obviously something happened that everybody's different with MS, but I think diet has a whole lot to do with it. Hypothyroid and Hashimoto's, there's a lot of evidence for the different minerals that Lee talked about and vitamins, proper protein intake, dietary fiber and fatty acids. All of that has been looked at and makes a difference once it's been diagnosed to reduce inflammation. And Lee, if you could, yeah, thank you. Rheumatoid arthritis, again, multiple different studies, multiple diets. With rheumatoid, the most common thing that I hear is to get rid of nightshades, and to get rid of sugar. Variable results on that, but with the Mediterranean and anti-inflammatory diet, we've certainly seen good results. Myasthenia gravis, there's not a lot out there with that one yet. It's kind of an interesting way the inflammatory process manifests with that particular disease. But there are some animal models out looking at probiotics and other factors in the microbiome specifically, and I expect that will be studied in humans over the next few years, and we'll start to get some answers there. And then one that I just saw this week that I loved was what Lee was talking about with the richness of the microbiome being our main measure, clearly associated with cognitive function. And again, this is in cohort studies. They're all listed in our slides at the end. But mostly what they've seen is some actual changes here in people's ability to think clearly, which is very measurable.
So with that, we will open up for questions, but just with a quick plug for the GW Integrative Medicine podcast. So anywhere you get your podcasts, if you like these sort of topics, we do podcasts on these sorts of topics. So please check it out. And with that, I'm going to stop sharing so I can see all your lovely faces while we chit chat. And it also makes it easier for me to look at the chat and see all the great questions everybody's asked. So let's see. Oh, the first question, which was, wow, really, really interesting. Someone was talking about, they wondered if our vitamin D absorption or production is affected by a depleted microbiome on the skin, which we know we do things to our skin that it was never really designed to do, like putting soap on it every single day. That's probably a little bit too much. And they're from Australia, and despite being in a beautiful country, they have some vitamin D deficiency, and we do as well. And a lot of it's because what we're doing right now, right? We're sitting inside on a webinar, which is fantastic, but we're not making any vitamin D.
You mean my ring light doesn't help me make
no, not that we can make it outside either, because we're not quite there yet. But that's a really interesting point. I would say there isn't data on that. But we do know that there have been significant changes to the skin microbiome in developed societies. I really wish we could go back and take samples of people before bathing was common, which wasn't that long ago. Yeah. And I'm pretty sure we could see a significant difference. So there's definitely something there. But as it relates to vitamin D, I don't know that it would necessarily affect that, because it's actually made it at a lower level in the skin, sort of under the skin. Mm. So hopefully it wouldn't affect that. But what it could affect is that immune interaction, right? So it could lead to inflammation, which then could affect the way vitamin D is being produced and all sorts of other not great things. So I like the way you're thinking on that, Lara. It's a really great question. Anything else you want to add on that?
Well, I was thinking about barrier dysfunction. I think my brain is still on that barrier dysfunction. And similarly to how we were saying that the barrier of the gut needs to be intact. And also let me clarify, it doesn't mean that it needs to be rigid and closed off. It actually has to have a semi-permeable membrane to allow the right things through and the wrong things don't come through. And we know that we experience similar issues with permeability on the skin, and that could impact skin function. And I would add, from an autoimmune perspective, the autoimmune conditions that cause skin issues might have this compounded aspect, right? The gut skin connection, the barrier function itself, their ability to the type of microbiome that's on their skin, their ability to allow things or not allow things in through that barrier. I think that all compounds the problem when it comes to those particular, like scleroderma, et cetera. So all that said, going back to that point, I wonder if the barrier piece, could things be blocked and or alter the UV exposure? I don't know the answer to that question, but could there be something in terms of barrier in addition to that microbiome piece that's different today than it was in the past? But certainly, to your point, Lee, like, something has to be said about the fact that we're just inside so much more. Like, even in our cars, we're still inside, right?
Right. Right. We're moving around the world and we're still inside. Yeah.
Right.
So I see a question about fecal transplants, meaning that was you. Anyway, the fecal transplants, to my knowledge, have only really been researched for Clostridium difficile infection, and only as a last-ditch sort of effort. The reality is, so yes, I hear you. If your microbiome is totally tanked, sometimes you need to get one from someone else. But it is I've only ever seen one patient for whom I was beginning to wonder if she needed something along those lines, because her microbiome was so messed up. There were lots of reasons for that for her. It was really destroyed at a point in her life, and near perfect diet, as far as I could tell, was not bringing it back. But maybe you guys have some thoughts on using prebiotics, probiotics. She had tried all that. So I think maybe as a last ditch effort, it can be used in some conditions, but we'll have to see. Some of this other research needs to clarify what about the microbiome we need beyond just diversity.
Yeah, I'm going to give a quick perspective, and then I know Lara will have a lot to say on this too. So in terms of FMT, yeah, that's predominantly where the research is. There's some other offshoots that people are studying things, but it's not really there yet. But in terms of industry, what's really interesting is they're actually moving away from that concept entirely. So instead of, at one point, there were companies that developed basically FMT in a pill. So they sort of took the feces part out of it and created a pill. But if you think about it, that's not that different from a probiotic.
Yeah.
And so what companies are doing now is they're creating what we call live microbial therapeutics, which are like a super probiotic. And so I see that being more the direction that we're headed, rather than sticking with the FMT. And there's a lot of reasons for that. For one, we don't fully understand how to screen people to provide what is a healthy FMT donor, and it's a little bit messy. So if we could do it with a more precise, what they call a consortium of microbiota, so a number of different microbiota, they're put together in an intelligently designed way, then that may have a better benefit without some of the risks of FMT.
And actually, there's some interesting work being done on that for farming. You know, so obviously a lot of these concepts work for the microbiota of the soil. And so they're already created soil things along these lines.
Right. Yeah. The microbiome of everything, right? It's all important.
Right. And that brings me to like our over sanitization of everything from food to, products that we use to, literally our day-to-day exposure. And I think that's really worth thinking about. Back to the FMT conversation, the infamous poop pill. I remember the conversation around that when that was kind of emerging as being the future of how we supplement probiotics. I think it was missing something. And I think, to your point, we don't know why is it that when you use FMT, it has a slightly better advantage in terms of stickiness, like in terms of it improving the microbiome. Part of it is the delivery method. When you put it in a capsule and you take it this way, it has to go through the entire GI tract, including a pretty aggressive gastric pH in order to get to its point. So it's very hard to deliver the capsules lower in the intestinal tract. And if y'all remember, intestinal tract is like basically doing loops and circles. So if there's already dysfunction in the gut, that's going to alter if there's shifts in bile production, if there's shifts in pH balance, if there's intestinal permeability or inflammation, all that could impact bioavailability of any capsule, let alone something as sensitive as a probiotic. So I think that's part of the reason why FMT seems to be beneficial. It's just the fact that it's getting right to the target faster, easier, without having to go through any of that aggressive parts of the GI tract. And I think another piece of this that's worth considering is there something inherent in the fecal matter itself that is feeding and making it better to, again, in terms of stickiness and long-term benefit. We know
right,
that
like postbiotics.
Yeah, like postbiotics, exactly. And as a result, that's actually why it's better. It's not necessarily the bug itself, but something about the matrix that it lives in that actually improves its benefit. And that starts to be very kind of meta. If you start thinking about it, it becomes very layered, because on one hand, we do know that probiotic supplementation helps, but we also know that it's short-lived for the length of the supplementation. We know that you could go too high, because we've seen fecal samples that have too high of something because somebody is particularly supplementing with those strains, for example. That in and of itself can cause a dysbiosis. Mm-hmm. So there is such a thing of too much of a good thing. And I think this is why a lot of us in the nutrition space are starting to really lean on food sources, like the fermented foods that you mentioned, Lee, as well as on prebiotic sources, so various fibers, and then really trying to understand the nuances of how those prebiotic fibers feed into the equation. And then, of course, my favorite thing, the polyphenols, the colors of the food, and how those polyphenols are, I believe, not just, I explain it like it's not just altering microbiome, it's communicating with the microbiome. There's a nuance there. There's a conversation that's happening that's a little bit more nuanced, that's alive. And I think that's where, honestly, I think what we're missing when we talk about probiotic supplementation and FMT and post versus pre versus probiotic is that there is a component here that's much more alive and almost like independently functioning than our kind of straightforward biochemical analysis and how we treat supplementation. Hopefully that makes sense. But to me, they're like these little critters that are talking to each other, and they're basically informing the distribution and the variety of the microbiome when we're ingesting those polyphenols.
Right. It's an ecosystem, right? We wouldn't think that we could change a whole ecosystem out in somewhere, a forest or the Amazon jungle. We wouldn't think, we could just change it by introducing this one small change in this one corner. That's probably not going to make a difference, or it could have a really terrible difference, like we have invasive species. So we have to be really careful when we do make these changes, especially if we don't have the full breadth of information, which I feel like a lot of times we don't have when we're talking about the microbiome.
And that's exactly what I was talking about with the research too, is that when you say, well, vitamin something supplement didn't help this, that, or the other, well, of course not. It's like one thing.
Right. There were 12 things wrong and you fixed one of them. That's not good.
And that actually really highlights why the research is not quite where we are thinking intellectually about it. Our model of research, our RCT trial gold standard, looks at one intervention and the impact that has versus placebo or versus another intervention. It's not equipped to look at the synergistic effect of these matrices together. And so until we come up with a better strategy, we have to keep that in mind whenever we're evaluating research, whether it supports the conclusions we want or doesn't support those conclusions we want. We always want to go back to, well, were there other factors that impacted that outcome that weren't assessed in order to keep this trial closer to the RCT standard?
Can I grab one more comment that I see that I think we need to address? Somebody says, speaking of skin, Does racial identity inform or alter any of your comments? And I would say, thank you for putting that there. And yes, absolutely, but not the way you think. So first of all, it does change your vitamin D, you know, how much vitamin D comes in through the skin. So people whose evolution has, basically it takes about 1,000 years, or maybe however many generations that is, like 20 generations, to turn skin from light to dark by moving up or down from the equator, right? So this is, it's like not hardwired in, but there is a change in vitamin D absorption. What does change your microbiome is stress, and racism causes stress. So it's not your racial identity as in skin color per se, it's how people treat you, which in this country includes a great deal of racism. I don't know too many other countries where it doesn't, but anyway, we'll worry about that. I mean, we have to worry about this one for the moment. But that chronic stress of having to worry about how you are perceived because of your race, because of racism, changes your response cycle. It increases your cortisol and makes you constantly on alert when you're around other people who aren't family or home or comfortable. And so that changes how your immune system is working all the time, and it acidifies your system and makes your microbiome different. So what I would say is, if you are somebody who experiences racism, then you need to be especially cautious of your diet, because you need it more. It's like treating a disease, except this is a social disease, and that didn't come out right, but you know what I mean. It's a disease of our society that affects you personally, right?
It's the systemic racism part of racism when we talk about it, and what 1000% spot on. And I would say it made me think about racial disparities as they apply to health outcomes and healthcare access from certain disenfranchised groups. And so, you know, it's almost like it's a chicken or the egg scenario. Did the increased stress from social situations, socioeconomic access, microaggressions, et cetera, create a stressful environment that altered the microbiome, that increased risk for disease, or does the increased risk of that disease due to those racial biases increase the stress of the microbiome? And so it's a little bit of the chicken or the egg, probably a little bit of both, but it really brings up a really important point in this discussion. So I appreciate the person who asked that question.
Absolutely. And in a truly integrative approach, stress is always going to be part of that, right? You can't eliminate stress, but you can manage it. So learning how to manage your stress, be that meditation, yoga, going for a run, spending time with family, whatever you need to do to help mitigate your stress is going to be extremely important. So thank you for that.
And then the rest of us need to work on the social aspect, because no matter what color you are, it's all our job to fix the external piece of that we all play a part in.
Absolutely.
Absolutely. So we had mentioned short chain fatty acids, and someone wanted to know, does supplementation of short chain fatty acids play a role in this?
I have a thought, but I actually want to hear your thought on this first. I think my thought is bias.
Okay.
Let me preface it by saying I have what I've seen in my practice thought about it. I know what the research says, but I have an alternative theory. So I'd love to hear your guys' thoughts on it, and then I'll circle back so I don't taint the water here.
So my general thought about this is, and I'm going to guess that most people would tend to agree with this because we're talking about the diet, we're talking about a gut-based approach, is the real goal isn't to deliver a supplement, right? The goal is to shift the microbiome so it's doing what it needs to be doing. That's really what we want to be doing. And so in some ways, the supplement's kind of missing the point. That being said, before we can make that shift, you still need all of those elements. So I think a supplement can play a role in as a stopgap, but I definitely don't think it's a long-term solution.
We're more on the same page than I thought, because I know I've seen data that shows that specifically isolating short chain fatty acids can have some benefit. but I have not found that to translate. Like just giving a short chain fatty acid, I don't think works. I suspect, and correct me if I'm wrong, I suspect it has something to do with, again, going back to that communication strategy. There's something in the way that the short chain fatty acids are produced that creates an environment that is then favorable for shifting the gut epithelial barrier, the mucosa, and the microbiome. And I think it comes down to allowing the system to do what it does to produce those short chain fatty acids. If you're missing the guys that make the short chain fatty acids and you just give the short chain, like that's skipping a really vital step. And if there's not enough of those guys and you just give them more, that's kind of missing a part of the step. So I often see like kind of promoting towards using short chains as sort of a direct therapeutic approach, and I'm not buying it yet. I'm glad my bias is at least.
Yeah, no, I think that's coming from a biomedical pharmaceutical model. That would be the solution, right? You're missing butyrate. Well, we'll just supplement with butyrate, but it doesn't actually fix anything because you didn't change what was wrong. So I think that we definitely need to get outside of that model, but not necessarily abandon it, because perhaps supplementing with butyrate in the short term will help move us in the right direction.
Correct.
And I think especially if it's treating something, so somebody has a disease that is related, you might need to short-term supplement some things. I'm not anti-supplement, and sometimes if it's a long-term chronic thing, you might need to supplement for a long time, but you know, you want to get the diet straightened out.
There's a great follow-up question to that. I think that can help us hone in a little bit more. Butyrate for enterocytes, particularly in those on low carbohydrate and keto. And I've got to say that keto and low carb definitely has a role to play in autoimmune disease mitigation. I've seen it work really well for some people, not necessarily for everybody. And that's true. That is where I see a lot of the recommendations for the short chain fatty acids. And then the question is, where would they get it from, especially if they're low carb, right? Considering they're high fat, high protein otherwise, and that's not necessarily supporting the microbiome. And that's definitely one of the criticisms of ketogenic diet.
But it could be. It's possible to have a high fiber ketogenic diet because fiber is not carbohydrates, right? Even though it comes in foods that are carbohydrates, we can't digest it, so we don't count that as carbohydrates. It's for the microbiome. So it could be done, but that's probably not happening if you're just doing it yourself. You probably need a registered dietitian or a certified nutrition specialist to work with you to design a ketogenic diet that is high enough in fiber to be fueling all of your enterocytes.
And there's something to be said about becoming keto adaptive, that once you're at a point where your body is essentially trained to go into ketosis more efficiently, you actually can tolerate higher and higher levels of carbohydrates. And that's where we would, as CNSs and RDs, design a plan that allows you to implement the right combination of fibers and polyphenols that maintain that flexibility, that keto flexibility, without sacrificing the microbiome, polyphenol, micronutrient piece that's really essential as well. And I definitely appreciate what you said about working with somebody to ensure that that quality is there.
And kind of in follow-up with what we're talking about, what about fiber supplements? So obviously we want you to get it from the diet because we're talking about that, but there are fiber supplements out there. I'm gonna sit back on this one. I have some opinions, but I'll let you guys go first.
Well, I think they're a reasonable short-term solution, but they don't replace like lots of vegetables and whole grains to my mind. I mean, it's really easy for me to get enough fiber before I even hit dinner, you know, for the day if I need to, which is amazing given that the normal American diet is less than half of what the amount of fiber one needs.
The minimum amount of fiber one needs.
Yes, the minimum amount. Yeah. So just get some beans and a ton of cruciferous vegetables, and you know, it's.
Yeah, absolutely. I think there's definitely a place for supplementation. I'm actually more on board with prebiotic supplementation than I am probiotic supplementation. And I think the data supports the use of prebiotics. They're safe and effective. They could be used long-term. And going back to our keto example, the right types of prebiotics can work in those initial phases as we're getting somebody keto adapted. I'm also thinking about folks that are maybe on a very restricted ketogenic diet because of seizures or cancer therapy. And in those cases, I think there is a place for those those prebiotics where you can't eat enough sufficient carbohydrates to maintain the microbiome. I think there's something to be said about that. There is also a caveat to that, is that I see a lot of IBS and SIBO type clients. And so as a result, I'm very cognizant of the fact that certain prebiotics, particularly in higher doses, can cause issues as well. So I think it's the right combination at the right time for the right person. I think that's really important. I don't think it oversteps the importance of the food first, because it's not just the fiber, it's the polyphenols, it's the whole matrix together that's having that conversation that's improving the microbiome. So I'd love to see the combo together. And that just reminded me of that paper that you shared, Lee, with us about the omega-3s and the essential fatty acids and their role as potentially having this prebiotic effect. So it's not just about fibers as we understand them. There's these beautiful combinations and compounds within those foods that naturally, I think, work together synergistically to improve the microbiome. So yes, I absolutely use them therapeutically. However, that does not mean that we get to sidestep that foundational diet that Suzanne mentioned.
Yeah, I totally agree with that. And the concept that you're talking about is one of the things that I lecture on a lot, actually. It's the concept of the food matrix, or also known as the entourage effect. So how things come together in a food is, for an easy way to understand it, that's how our body is used to seeing it. And it's very efficient at getting things out of that food and utilizing them. Whereas you take one piece out of that, you put it in a supplement, you deliver it, the body does not use it in the same way at all. And it's quite surprising. There's been some research out there, unfortunately has not been published yet, but with lutein supplementation. So lutein is found in all sorts of different things. And this supplement, the study actually was not designed to answer this question, but they gave a supplement of eggs, the food egg. They gave a supplement of avocados, which they actually thought would be the negative control because it's relatively low in lutein. So it's like a food that's high in lutein, a food that's low in lutein. And they give a really high dose lutein supplement. So they thought that's the one that's really going to pop out because it's got so much lutein in it. Well, interestingly enough, the egg came in number 1, the avocado came in number 2, and the supplement came in number 3, even though the avocado had 1/100th of the lutein in the supplement.
It's
so
not even red.
right. Exactly. We're talking about really low levels, but the body is just better able to extract and utilize them when they come in these food forms. And I think that extends to fiber as well, right? So fiber plays a role in all of these. So pulling the fiber out and taking the supplement, to me, is not ideal. That being said, if you are really struggling with getting your fiber intake, it is there. And then the other thing is getting a variety of fibers is really important. So if you're taking it as a supplement, you're only getting often one kind. It might be FOS or GOS or inulin, and that is less than ideal as well. So that's sort of my 2 cents on the prebiotics.
I love it. I'm just loving all these questions, by the way. Thanks everybody who's submitting.
Yeah, they're great questions.
They're awesome questions.
There are a couple questions about allergies, and I have some thoughts, but Lara, you've probably dealt with this more than anybody.
Yeah, I really appreciate this question from Dr. Miller. And there is was that the one from, no, that wasn't the allergy one. I'm going to come back to you, Dr. Miller. There's another one specifically on allergies. I don't remember where it was, but the difference between allergic and autoimmune disorders. So to put it simply, there is a different immune dysregulation that occurs in allergic disease versus autoimmune disease. In the most simplest term, you could think of it as 2 arms of the immune system. And with autoimmune disease, you're upregulating one side, and with allergic disease, you're upregulating the other. However, nothing is that simple.
Especially in the human body.
Especially in the human body. And depending on, so there's a couple of things to kind of bring your attention to. One, there are autoimmune diseases, classified autoimmune diseases that are actually autoallergic diseases, or a combination of autoimmune and autoallergy mess that's happening there, right? So there's that. The other aspect of this is we used to think that if you developed an autoimmune disease, you should have primarily autoimmune presentation and that there's a clean line. And one of the reasons we thought that is, for example, in pregnant women that have an autoimmune disease, they get pregnant, we see a natural rise of the allergy side, and that tends to shut down the presentation of their autoimmune disease. When we go, see, proof that when you raise the arm that's allergic, you can suppress the arm that's autoimmune. However, I'm going to tell you colloquially, I have seen it over and over where I've got a woman that presents with allergies and autoimmune disease all at the same time. And not necessarily autoimmune diseases associated with allergies. Hashimoto's is probably the #1 autoimmune disease that we see. And I can't tell you the number of particularly women who tell me that they have terrible allergies, that have histamine intolerances, and yet are presenting with Hashimoto's, which is conventionally considered a purely autoimmune presentation. So it's complicated. The two can definitely overlap. I have come to believe that if you do have allergic triggers, that they will worsen the autoimmune imbalance. They'll make it harder to bring the autoimmune balance arm into play if you're presenting both simultaneously. But there are some cases where they'll feel better from their autoimmune side when their allergies are flared. And it's like they got to pick their poison. So what we do instead is focus on how do we balance the most foundational part of the immune system, how we balance the gut microbiome, its interaction with the food and environment on that level, as well as how do we upregulate the Treg cells, essentially the regulators, the maestro, and then how do we use certain nutrients like the ones you talked about earlier, Lee, like vitamin A, vitamin D, vitamin C, quercetin, luteolin, all these various compounds and nutrients so that we can get the foundation of the immune system. Obviously, we want to get rid of any triggers that are creating this dysfunction, but it is important to note, and I'm glad that question came up because I think there's a misunderstanding. I think it's well-intentioned to try to simplify the situation, but I think there's a misunderstanding that the two can't live together.
Yes, I very much agree with that. The immune system is one of those things, the more we learn about, the more we realize we don't understand, not dissimilar from the microbiome and gut health. We're just cracking open this really interesting onion and figuring out what's in there. So there's going to be a lot more. Related to that, someone had a question about how do you manage someone with histamine on a low FODMAP diet?
Very carefully.
Yes, I personalized approach.
Well, I'll share what I do in my practice, and I'd love to hear you guys' thoughts on this. So what we tend to do is focus in on the safer foods. Number one, I have found that not every FODMAP and every histamine food is bad for everybody. So the first thing that we do is try to identify which specific foods are problematic. So that usually means putting them on a low FODMAP, low histamine plan, then reintroducing them carefully using a really meticulous approach so that we understand exactly what's happening when they introduce a food. That's number one. Number two, foundational concept to understand, it's not no FODMAP. It's low FODMAP. It's not no histamine, it's low histamine. And this is a very misunderstood concept. It's not about removing all FODMAPs. That's impossible. It's not about removing all histamine. That's also impossible. It's about reducing the exposures of the biggest offenders. And remember, depending on what's happening in the microbiome, their responses to those particular histamine and FODMAP specific carbohydrates are going to vary. So that's why we sort of start by mitigating the reactions, kind of getting them down to as close to baseline as possible. I find it's often not enough on its own, by the way, as a mitigation strategy. And then we re-challenge foods back in so we can find the right combination. And then we lean in on the safest pre-fiber, prebiotic foods that we can. And I encourage a lot of diversity, polyphenols. If they can tolerate ferments, we do often, folks with histamine intolerances can't do fermented foods, so we avoid them. But if they can tolerate them to some degree, we will encourage them. And then we lean on making sure they're getting a balance of their other macronutrients as well as their micronutrients. And so that's our initial strategy. We've got to do some gut work. I saw a couple of questions about how we decipher what's happening. So I'll use this as a as a lead into that question as well, we'll usually do stool testing. There's a few different labs out there. I utilize a lot of the GI effects, the GI map. Those are the big ones that I use in my practice. That helps us understand what the commensal flora looks like, as well as what potential overgrowth or opportunistic invaders might be in there. And that also gives us an idea of what's happening in terms of inflammation, what's happening in terms of secretory IgA, mucosal health, digestive markers, et cetera. And from there, we'll usually create what we call a 5R approach. And then we'll use either antimicrobials or antibiotics to remove the things that are causing a problem. We'll support digestion, sometimes with nutraceuticals, sometimes with lifestyle changes, and then we'll move into sort of repairing the gut. And then depending on what's happening in the gut, then we'll customize a strategy of how we go in with prebiotics and fibers and whatnot. So that's a very, very thumbnail picture at that. It's much more complicated than that, but I hope that answered, because I saw a bunch of questions about that, and I hope I covered all of them.
That's wonderful. The other thing I would add too is part of the reason you get to reintroduce these foods is the microbiome actually changes with diet. Like part of the reason the low FODMAP diet works, it's actually changing your microbiome. Now, short-term changes in the microbiome are transient, right? So if you like go out and you have, eat a bunch of bad food, right? Like it's Christmas and you're enjoying your Christmas cookies, do that. It's fine. It's going to recover. But if you're on something like a low FODMAP diet for 6 months to a year, that change is really essentially semi-permanent. And so unless you do something else to do a long-term change, it's going to stick. So once you've changed the microbiome, then you can start reintroducing these foods and you shouldn't have the exact same reaction because the microbiome is now changed. So we've tied it all back together into a nice
actually
little
goes
package.
back to Dr. Miller's question in the comments, talking about shifting the conversation that's happening with the microbiome with various shifts, whether it be food triggers, physiological triggers, environmental triggers, infectious triggers. I think that is a fair conclusion, that those change as tolerance and necessity changes. So food, we tend to think of dietary recommendations as being linear. You're supposed to eat this. This is, here's your plate or your pyramid or whatever you want to look at, and you're just supposed to eat that. This is it, set in stone. And it's not quite true. It actually shifts with age cycle, environment, exposures, needs. And so when we talk about having flexibility and having a dynamic diet that reacts with the environment, I think that starts to speak to how food translates, how that matrix you're talking about translates into information for sometimes repair, and sometimes it's just holding steady and preventing damage. And we need to be more flexible in our approach.
Well, we are out of time, so I think we're going to have to end there. But as we said at the end of the last one, I think we could do a follow-up. So if you do have other questions, please do continue to submit them, because we could use them in the planning of our follow-up webinars. And thank you all for attending. And thank you so much for being with us, Susan and Lara.
Thank you so much. This was such a great conversation. And again, a big thank you to everybody that's out in the audience and for the great questions.